such, there is a decline in all the reproductive hormones. Estrogen goes down, even your testosterone start going down.
Menopause means we associate with a complete decline of estrogen progesterone. What is the shift that is actually happening here?
It can affect your heart, it can affect your breast, it can affect your cognitive function, it can affect your moods. It has so much.
There's nobody to give care to women. A woman means take care of the children, take care of the husband.
They are the one who should really understand that yes, it is a physiological condition.
Do you think this local vaginal estrogen is very helpful? Is it?
Vaginal estrogens are also a type of HRT. So HRT is not a combination of medication or something. HRT could be only estrogens.
Welcome to Feminine Systems podcast, where we not only heal and empower women but also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author and an entrepreneur. Today we're going to have a special guest, Dr. Bharathi Singh, who's a consultant gynecologist at Bharathi Women and Child Clinic, Coimbatore. She has over 10 plus years of experience in the field of treating menopause. Today she's here with us to break the myths of hormonal therapies, and she will walk us how to cruise this phase of perimenopause and menopause. Welcome Dr. Bharathi Singh to Feminine Systems podcast. Dr. Bharathi, could you tell us what are the most bothersome symptoms of menopause?
Okay, to start on a lighter note, menopause. Okay. So it's quite self-explanatory. And now coming to your question, menopause, the most common symptoms with which we see patients in our clinic is hot flashes, sleepless nights, brain fogging, cognitive problems, joint pains, and putting on a lot of weight, mood swings, evening depression. These things bother patients a lot.
A lot. Hot flashes. What does that actually mean?
Okay, to explain you a hot flash as such, we all are sitting in a room in a very comfortable AC, and suddenly the woman starts feeling something burning in her feet. And slowly starts up, it comes to your head and your body is on fire. And then after sometimes you sweat. Okay, so this is very typical of a hot flash. You can get any variant, sometimes your feet is burning, sometimes your head is burning, and we see some triggers also to it, like you're having a discussion with someone in which you have raised your voice, or you have had a sleepless night, you had a lot of caffeine. Okay, all these things can trigger your hot flashes. That's how it starts. Then slowly it takes a typical form, and when it's a recurrent episode, only then patients come to us. That's when it bothers them. Otherwise, they always tell it's because of this, it's because of this.
Yeah. So, and actually, they sweat and sometimes wake up from sleep.
Yes.
Yeah. So, why does all these changes, like you said, brain fog, again, so much weight we gain, and you start feeling joint stiffness and all that. Why do you think, all this while we were fine, after menopause, why do you think this happens?
Okay. So, we have a very sweet friend with us in our body that's called estrogen, and it starts betraying us at menopause. Okay. So,
it's not doing this for the men, right? Men, it's not happening.
That's a totally different topic. Maybe we can have a podcast time. There's something called andropause. Okay. So,
But it is not so just like this where we are, pushed into something all of a sudden. The full well-being is really, kind of taken, but for them they continue to gradually decline, because they say every year there's only 1% decline in testosterone levels, but here suddenly it just stops, right? So
that's the beauty of our body. We attain menarche, then we have a reproductive period, and then we enter menopause. So menopause, as rightly said, is just a phase of your life. You have a very beautiful life ahead. It gives some hitches, some problems to us, and which we can manage nowadays very beautifully without any problems to the women health as such.
These symptoms, why does it occur? Because of this estrogen withdrawal. But overall, what does changes actually happen for all these? So many symptoms occur, right? From hot flashes, like you said, the belly fat, everything. So what is the hormonal shift that makes this happen?
So as such, there is a decline in all the reproductive hormones. Estrogen goes down, even your testosterone start going down, your androgen level, first they peak and go down. So it's not only a decline, it is a major shift in the hormones which we were carrying for the last 20-30 years, which causes this problem. So like for example, you have hot flashes, you have mood swings. All these things happen because of your low progesterones, low estrogens, your bone health. Osteoclast activity gets changed because of the less estrogen. And this osteoclast activity, which is present in our bones, causes our bones to slowly go for osteoporosis, okay, weakening of the bones. So everything ultimately is attributed to this, not the decline as such, but a rapid shift in the hormones. And the shifting only causes all the problem. So once you have shifted, once your body has got adapted to the new hormonal system, then things start stabilizing. But at the same time, your body does need something extra to cope up for the loss of hormones which we had.
Menopause means we associate with a complete decline of estrogen, progesterone, as well as testosterone. So, what is the shift that is actually happening here?
Okay, going too much into science, it all starts
so
from
today. I think everybody is very well, educated. They are all well read.
Right.
No, we are seeing that in the practice as well.
You're right. Okay.
So I thought if people can understand it, they can actually relate to it much better because now they talk all medical language very much to me. So
yeah, you're right. So yeah, once we start to educate our patients, we all start from our hypothalamus. Okay, it's the hypothalamus secretes FSH hormone, LH hormone, the pituitaries, they secrete thyroids as well. And these hormones go and work on our ovaries, where they secrete all the other hormones. Okay, so then if our body is set up with a particular time of our life when the pituitary hormones will change, the FSH levels, the LH levels, the AMH levels also will change. Okay, and this change induces our body to go for the deficit of the other hormones. Also, it's not a game of only estrogen, progesterone and testosterone. There are other hormones also involved.
I want to tell you, like, this estrogen is like, people think it's only an ovarian hormone, and no, it has receptors all over.
Yeah,
right?
Yeah,
even in the brain.
Exactly.
So
it all starts, estrogen has receptors everywhere, right? Right. Only when it goes deficit we know. Okay,
True.
We know the importance. So it can affect your heart, it can affect your breast, it can affect your cognitive function, it can affect your moods. It has so much of importance in our life. As I told you, it's a true friend which betrays at 50.
Yeah.
Okay.
And it's friends, so many other hormones and everything. So it does have an effect on the other hormones as well.
Exactly. It affects your cortisol levels, it affects your steroid levels, and it affects your thyroids, okay, and it affects your DHEAS levels, it affects your adrenals, okay, it has a direct effect on all. It is a big physiology involved, but yes, all these hormones are also affected, because of which you will see a lot of changes in your body, lot of symptoms in your body, like the weight gain we were talking about, the metabolism goes down, you have to change your diet according to your body. All these things are actually related to the play of these hormones.
Yeah, true. Because of this cortisol, stress hormones, again insulin resistance that peaks again. All this increases fat deposition on the abdomen.
Yeah,
right?
That insulin resistance, it's a big topic. I didn't want to touch it, but then, as you told, belly fat, insulin resistance.
I know. So, and it is so... It aggravates during this perimenopause and menopause, right? So all the time we were feeling we were eating less, and still we were okay. But suddenly you start gaining only there, and you feel bloated all the time. So these changes. I used to wonder why menopause is for human beings, especially women, because throughout all the living beings, only human beings and I think killer whales, they live after menopause. Yes. Once the reproductive function is over, I think the species is like, you're not fit to live, so there's no more role for you. But today we see post-menopause, which is like around 48 is the current menopausal age, which was 52 and now it has come to 48. And people are living 30-40 years after menopause, a significant portion of their life. And with all these changes where you really appear to be like a new person. Exactly. Not even the old self, right?
Yes.
In so many ways, because the shift affects all the hormones. There was also a hypothesis why this change is there. They said there's a grandmother hypothesis. That means the wisdom of us should be transferred. But women are not educated to really cross this transition. There is something called perimenopause. There's something called menopause. Could you tell me about perimenopause, what it is, how many years it lasts, and about menopause?
Yes.
The definition, what we come with.
So there is actually a scoring system which has developed. That scoring system tells us that perimenopause starts as early as 40. Some books even say at 38, but as far as our Asian population is considered, we will keep it as 40. 40. So, and for Indian population...
For 40 and above, please, anybody 40 and above, please share this podcast. Yes. It might be very useful for them.
Yes. So this perimenopause word should not scare you. It should only tell you that yes, now you have to work out on yourself better than what you were doing earlier. You can't take your body for granted. So after 40, you need to sleep more, eat better, and weight-bearing exercises. Very important. And cognitive functioning, what all you can do for your better cognitive functioning, you have to do that. You have to take care of yourself because there is a rapid shift of hormones after 40. You enter the perimenopause where you can sometimes get those little hot flashes, little mood swings and stuff like that. You can start putting on rapid weight if you don't control your eating desires.
Yeah. And there's craving also that happens here because of the erratic hormones. There's suddenly a lot of sweet craving that happens.
Especially premenstrual.
Absolutely. Premenstrual, there is very significant. And there's again, at least at premenstrual, there's a mood swing which was there. But now it has become more the sweet craving is very significant. And the mental fog, even I myself experience it, Dr. Bharathi. So, so now it hits you so hard. We were not prepared for it. It is, people who go through it, there is not much of language or literature, people talking about it overall.
Exactly.
The woman herself is not prepared for it, and people around, because this is the time, one of my friend told me, oh my God, a younger friend. So my mom is in this perimenopause stage, and she behaves so cranky. We find it so hard to handle her. We are like, before, a few days before periods, we really run away from, talking to her only. She behaves so cranky. So literally a woman is going through so much that she has to, kind of present like this. And people around her is also, they're not trained to be receptive to her shifts.
Exactly.
Right? So,
perimenopause and menopause, we should understand it's a very difficult time for the women because nowadays most of the women are working also. So the work pressure is there. At home also, her chemistry with her husband might change. Kids are growing up. That stress is there. Then with all these hormones, there is something called as tender loving care. This tender loving care should be taught to their family. The women needs it. The women needs it. The women's body needs it. Only with this tender loving care and the family.
Women are the ones who are supposed to give this care. There's nobody to give care to women. Sorry, we are not taught that in our culture, right?
Yes.
It is like a woman means take care of the children, take care of the husband, take care of the mother-in-law, father-in-law. Even your parents are aging. Everybody's nurturer, take caring is by the women. But who actually with so much physiological shift, she really, her well-being hormone, I always call estrogen the well-being hormone. Like it is completely coming down. Who's there to really even understand her, listen to her? Right.
So difficult task. That's what this podcast should be shown not only to the women,
to their
but
husbands,
to
also.
their family also.
Okay.
No, they are the one who should really understand that yes, it is a physiological condition. It's not that something which is there in her mind. It's not an overnight shift in her character which has happened. It is all her hormones which are playing, and we need to really calm it down and deal with it the way the women has dealt with so many other problems in their family.
Correct. So, and by the textbook definition of menopause, how many
for the
months?
Asian women, the age is around 48-50, and at least 1 year you should not bleed.
Have periods.
You should not have periods. You should not bleed, and that is considered menopause. There are so many tests which we can do to find out perimenopausal status, or you have gone to menopause and all, which we do not recommend usually. But then, if there are any medical concerns, we go ahead and
if the symptoms are very severe, maybe
to find out, to diagnose that it is perimenopause and nothing else, we do those tests.
Can you give us some hacks to handle this perimenopause? Because symptoms start from perimenopause, right?
Yes.
So can you give us some hacks there? Because since we might not right away jump into any hormonal therapies like that, but thinking of certain important aspects which people can incorporate in their life.
So I am a very strong believer that everything starts from your diet and lifestyle. So that's the first thing which you need to take into account and change when you enter 40s. Okay, so your lifestyle should include a lot of sleep.
The main purpose of this Feminine Systems podcast is actually to bring this emphasis on this factor that almost 30 to 40% of diseases can be prevented or delayed if a diet and lifestyle is altered. Changed.
Exactly.
At least we can prolong certain things to come much later, right? So, and specifically women-centric health, because there is so much importance given to men's health and things. It's not a feminist podcast, but it is about the variability and changes that happen in women, which is little overlooked, because every system that has occurred is because of created by the patriarchy or the male-centric view about what actually is. So in that sense, these hacks, because nobody wants a treatment, but this, as you said, lifestyle changes, could you give us probably cover almost everything which will be very useful for somebody very sincere enough to take it up and apply it in their lives.
Exactly. Okay, so what if I'm sitting in my OPD and a patient walks in, the first thing I tell is lifestyle changes. What is it? Sleep well. 8 hours of uninterrupted night sleep is very important. Stop scrolling your phone. Keep it aside 8 o'clock evening and have some time with your family and sleep. Finish your course early and sleep. Okay. The second thing is diet. Very, very, very important. Less of salts, less of spices, less of oil, and more of proteins, more of veggies. And please include estrogen containing diet like flax seeds. You can include that flax seeds in your diet to increase your estrogen levels, and drink lots of water. And diet, there is so much to talk, we can talk hours about it, but these are some things which you should take care.
Calcium rich
diet, and then we are going to add a lot of calcium and vitamin D in our diet also, and obviously sunrise, and weight bearing exercises, muscle strengthening exercises, because as the perimenopause starts, you lose a lot of muscle also.
Very much. Yes, there's almost a 20% muscle loss which happens after 40. Which
after 40. So, earlier the better. Please start your weight bearing exercises and training in early stage than late.
Yeah, it's very important people choose strength training, and as you say again, weights and cardio is, you need not really do this marathons and all, not necessary. What is suggested is the zone 2 kind of activity, where even simple walking, fast walking, swimming, these yoga and these kind of slow but 30 to 40 minutes of activity, not that high intensity workouts, maybe that can be once in a month or something during that ovulatory time. That's what they say.
Yes.
It is more effective rather than, else you're actually increasing the cortisol by like everyday running. Maybe it is very optimal for the men, maybe because they only follow the circadian rhythm. But for women, where we are very cyclical, and for us, I think we need to little more make changes based on our cycle overall. So, and if after these dietary modifications, for a menopausal woman, if she still has symptoms, what are the options?
Okay, I will still hold the hormones. Okay. There are so many non-hormonal medications which can be given to the patient after, it depends upon if she has a bone loss or something, if she has joint pains, then we have so many medications in the market like tibolone, so alendronate and all those things which we can try on the patient. If they have urogenital atrophy, meaning vaginal dryness or stress urinary incontinence, then we can treat those symptoms as such and combine with all these medications. I feel most of the patients can still be treated with non-hormonal medications than jumping into hormone replacement therapy directly. Yes.
Do you think certain adaptogens and certain herbal preparations like Shilajit, Ashwagandha and Maca, these things, does it have a role especially in the perimenopausal or postmenopausal women?
So as far as any component gives you the required amount of estrogens and progesterone in natural way or otherwise, it is fine. I'm not the right person to answer this question because it's beyond my scope of knowledge, allopathic knowledge. But as far as any compound, like for example, we spoke about flaxseeds. So what do? They give us a required amount of estrogen.
Phytoestrogenic effect, right?
So the same thing, if any component is providing us, then it's fine. Then it's good. It's actually good.
And safer also.
Yes. Yes.
Yeah. So do you have a role for, most women do complain lack of libido or the sexual drive decreases, the dryness is very severe. We call this as this genitourinary symptoms of menopause, GSM, right?
Yes.
So here, do you think other modalities like PRP injections or laser, does it have a role and how helpful it is?
Yes. As far as PRP and laser is concerned, my experience is good, especially the urinary symptoms. Urinary symptoms, stress incontinence, it has worked wonders.
Absolutely.
Laser.
Yeah, because most women, they say they don't talk about it. Stress incontinence is like nothing, even if it's a mild degree where somebody sneezes, coughs, or even climbs the stairs and there is a slight urine leak. Most women are subject to this. The severity varies, and once they've had a delivery previously, these people do experience it at some form. Correct. So for them, most people don't go and ask for a help. They just quiet. They think it is a part of normal aging. So there are options like, as you say, PRP, especially in these women, right? Like these are used for hair transplant and everything, but it has also been explored here.
We have used PRP in quite a few patients.
And it's very successful.
Yes, it is very successful. It helps.
And
patients
laser,
are happy.
And laser also.
Yes, laser. Laser, definitely it helps. Patients are happy.
Does it improve their sex life also, doctor?
To some extent, because it can only treat your vaginal dryness. It can't treat your central system hormones where the loss of libido comes from.
Correct.
So again, you have to work on your estrogens and testosterones.
Okay, so let's go to hormone replacement therapy or the hormone therapy. There was always a fear. Even as you said, I will go to the hormones as a last resort. And there was a fear when I studied my MBBS. It was like, I associated this with, risk of breast cancer risk. But later on, we found that the latest researchers are telling it the other way. because the preparations used during the studies were different, and they were very high doses. The study is flawed and everything. But currently, we find a lot of women opting. Those days, only celebrities were using it, and today it has become more mainstream. Many people are using it. So, what could you enlighten us about the fear, and is it safe to opt for hormonal replacement therapy now?
Yeah. One more thing I wanted to tell you, when it comes to hormonal replacement therapy, and nowadays some people even opt it over the counter. I would caution it, don't do it.
Yeah. No, it is available on, you just have to put it on ChatGPT. You can just put it on Google search, and Amazon has so many OTC. Any spas and wellness brands, they are also rampantly marketing it. Insta feeds, you just have to search about menopause. Somewhere you had a search and it shows to you. There's so many products, which is not regulated also, are available today. So many buy that, they're convinced by the marketers rather than the doctors most of the time.
Yes.
And they buy it as well. So good that you have please emphasize, doctor. I'm very happy somebody tells that, because please don't buy over the counter, especially the hormonal. There was like, I remember in the US, especially now we are slowly always copying them and becoming like them. Over the counter testosterone boosts were very, very commonly used in the West. Now again the same thing is happening.
Yes, very much available.
Very much.
Yeah. Okay. We can only educate people. There are a set of people who, when they hear the word hormone, they run away. Oh, I don't want to take hormones.
Correct.
I don't want to take hormones.
A lot of side effects, because we think it is a lot of side effects.
But then we should also understand these are the same hormones which were there in our body, and they are not there now. So you're just giving it from outside. What could be the harm? If you want to eat 2 idlis and now your body wants 3 idlis, the one extra idli from outside is not going to harm you. Why I'm telling it so confidently is, nowadays we have a better form of estrogens and better form of progesterones available, which almost mimics the same estrogen which is there in your body. And that reduces the amount of side effects which we used to have 20 years back. When they started HRT some years back, it used to be very high dose.
Correct. See, the study was published in 2003, I think.
2003, long back.
So if the study was published, then the study would have conducted earlier.
Yes. So we are talking
25
about
years
history,
back.
We are talking about
25 years
history.
back.
25 years, everything has changed about HRT. You don't even have to pop in a pill. You need a transdermal patch, you need your vaginal cream, or you need some implants. That's all you need.
Correct.
It's much more than just medication.
Different forms and different, even the hormone itself is they say bioidentical hormones.
Yeah, that's what I was saying. It's almost identical to the estrogen you have in your body.
What was there in the body.
Yeah. And the way you give it also has changed. And the dosage, earlier it used to be some 1 milligram, then it came to 0.625, then 0.5. Now we recommend only 0.25.
Right.
0.25. So, how is it going to harm you? No. That much you will even have in your diets.
Correct. So, but that small dose can actually significantly alter your well-being.
Yes.
Right? So
you will be all,
Correct. You might be feeling little normal the older self, right? Suddenly you become like a new person. So the transition, does it help in the perimenopause, or you recommend it for?
Perimenopause patients, we should understand that they still have the hormones in their body. So the replacement will not work for them. Only supplements can work for them.
Correct.
Right? We don't need a replacement for them. But when you achieve menopause, your hormones have declined sharply to the levels where it's not affecting your body, and that is the time when the replacement starts. Yeah, so it's strictly, if you need to go for a proper HRT, menopause.
So, how many patients in your practice today opt for HRT?
Okay, so it again depends on what cadre of patients you see. If I get 50 menopausal women, to be very frank, only 10 of them are candidate for HRT. and hardly 4 or 5 opt for it.
Okay. So almost 40 are not even candidates for HRT. You
Yes,
say. Yeah.
yes,
So they
yes.
don't require it.
Yes, in the sense they may require it later,
Okay.
but for now they can still be managed with their lifestyles and what we discussed till now.
Yeah. So won't we be missing that window of opportunity? What this HRT does? There is always the common currently the studies suggest the hormone replacement therapy helps in protecting your heart,
Yes.
your bones, as well as your brain.
Yes.
So in this space, do you think are we depriving the women by not offering it?
Yeah, that's where a doctor and a chat GPT differs. Okay, yeah. What I mean to say is it's an individualized approach.
Yeah.
Okay, so this window of opportunity doesn't fit everyone.
Right.
If you very curated family history, the history of the women, how much risk factor she has to develop a cardiovascular disease, how much risk factor she has to develop the breast cancer or any other diseases, we have to calculate, we have to put a scoring and then decide whether this patients will really get benefited from HRT or not. It's not that you walk inside, you tell I have this, I have that and I put you on HRT. No, that's wrong. That's wrong. We need to find out the right candidates who will really get benefited with this window of opportunity period.
True, because I see rampantly a lot of the influencers on the Instagram kind of they push it. They are even they showcase their patch, their creams and their shots, whatever
Yes.
they are taking.
Yes.
They so this is what helped me. That's how I'm able. Oh my God, that is a tailored, personalized. A therapy for them. You have no idea. They don't talk about the full history of what gave that or led to that prescription.
Yeah.
And immediately, these people go and search for that and buy it. And it is also abuse. Like those days when those postponing periods, there were tablets which was abused and bought over the counter because I wanted to go to temple, because I wanted to that day is my family function, marriage. I want to postpone my periods. Go rampantly buy it, abuse it. Then this was a reason again for those DUB kind of bleeding, which was they kind of altered the cycles and people always came up with those things. Again now we see this kind of trend because I did know somebody who uses it without anybody's prescription. So these things actually they take it lightly. Either one end of the spectrum they're too scared that these are cancer causing, or the other end of the spectrum, let's take it as though it is like it's a cool thing to do.
At the end of the day, it's a medication, and any medication should be only prescribed if needed.
Right.
If needed.
If needed.
Yes.
Very, very nice. So, do you think testosterone supplements and replacement has a role in women?
Yeah, if they have serious issues related to lack of testosterone, we can. It's a very tailored choice. It's a choice which we have to give to the patient, but it's not must. It's not must. That's my take on it.
Who are the candidates for testosterone?
Okay. Most of the women would like to hear it. Lack of sexual interest.
Yeah.
In my practice, I see a lot of patients with this kind of complaint getting benefited from testosterone shots. But again, as I told, talk to your doctor before taking it.
Yeah, very important. And you'll also know the right preparation, duration to take. And
we don't give it that easily.
Right. And I think starting hormones should have a blood panel workup also.
Exactly.
And then, because that should be a baseline before starting.
Yes.
And it has to be monitored over time and all. So, do you think this local vaginal estrogen is very helpful? Is it overused or underused? What is your opinion?
Vaginal estrogens are also a type of HRT. So HRT is not a combination of medication or something. HRT could be only estrogens or estrogen progesterone combination. And when it comes to only estrogen, this is one of the way which we deliver estrogen. Yes, It does helps in urogenital syndromes a lot. But if used for a prolonged time, it will cause vaginal bleeding. It will cause a lot of problems because it does get absorbed in your body. And everywhere where you have estrogen receptors, anything in excess, as I told, estrogen double-edged sword,
Correct.
it will harm you.
Correct.
It will harm you.
Is HRT still considered a gold standard for protective for bone health?
According to me, yes, very much yes. Okay, so there is something called as a DEXA scan, which we can do in all the perimenopausal women as such.
Correct.
And if it shows that there is a loss of bone in your body and you have already reached menopause and then there is a loss of bone in your body, why not start you? If the calciums and vitamin D3 are not helping, start HRT.
Absolutely, right. This is something which people don't associate bone health with estrogen.
Yes,
that is the thing. This declining. It's just assumed like we are similar like men only. So for men, as aging, whatever happens, it's been associated for bone health also. So DEXA can be started perimenopausally.
Yes, you can
right?
do it.
So
yes, you can do it.
do you prescribe bisphosphonates?
Okay, yeah. So again, bisphosphonates is also related to your bone health. Yeah. Before starting HRT, we can give bisphosphonates, salindronate we can try on the patient. But again, after evaluation, yes, we can.
What are the long-term risks associated with bisphosphonate use?
Yeah, bisphosphonate itself, the most common and the most irritating side effect would be severe gastritis, you know.
Yeah.
And after 6 months to 8 months, we don't give it usually. Okay.
So what is the right window to start HRT for women? So
okay,
right age to actually.
Right age. Immediately after menopause is the time where if the patient is a candidate, we should start. We can continue HRT for 5 to 10 years. Now, the latest guidelines tells 10 years, okay? But then there are so many experienced gynecologists who even give HRT beyond 60. But I, in my practice and most of the gynecologists in their practice, start immediately after menopause if you need it and stop it 10 years. And after 60, not recommended.
Not recommended.
Not recommended.
So there is no point even in starting after 60.
No.
The protective effects are actually.
It is a gray area. According to the experience of the doctor, I have seen so many of my fellows who does prescribe it after 60 also. But to be on the safer side, and if you go according to the protocol, after 60, no. Better no.
Who shouldn't be prescribed HRT?
Okay, yeah. Over the counter, not possible, first thing. Second thing, and any patient with history of endometrial cancers, breast cancers, big no, big no. Even then we have something like those transdermal patches of estrogen. If they are very bad symptoms, not getting okay with any of the non-hormonal therapy, we can still give, but with precaution.
Asking about this transdermal patch, how is it applied and used, and how frequently it is changed?
Transdermal patches, the first thing is, very important thing is, you should, mostly in the arms, women will use, you should not use a moisturizing cream over it. It reduces the absorption of the estrogen. Okay, and then there are so many transdermal patches which 3 weeks, 1 month, 3 months, 6 months. Okay, but usually what I give is monthly one. Okay, so this is one thing. No use of moisturizer, and then there are some creams also which are available. The same thing applies for them. No moisturizing cream over your body. Take it and just rub it like this. You need not rub it like this.
Right.
You know, you need not rub it like this. Just put it once. Smear it, and then 15 to 20 minutes, no contact with the cloth. And that's how it works. That's how we should use it. That's the correct way of using it.
Right. So progesterone, either as oral pill or a vaginal or Mirena. So which is a preferred?
Oral.
Oral
is okay. Oral is enough.
Yeah. So can HRT be prescribed for women who don't have a uterus?
We can give HRT, but then you don't use progesterones in those patients.
Absolutely.
Estrogen is enough. Estrogen is enough.
Right. Because These are the common misconceptions and confusions that are, you know, among the common
how to take it,
right? So, going to the my favorite part of the Feminine Systems podcast, the rapid fire. So, hot flashes, mind body issue or a biochemical shift?
Definitely a biochemical shift.
Best age to start thinking about bone health seriously?
40.
Not 35?
Okay.
What's safer, transdermal estrogen or oral estrogen?
Transdermal estrogens.
Which is your favorite calcium food? Calcium rich food?
I'm a vegetarian. Okay.
What's your favorite calcium rich food? Like
Ragi. I eat a lot of ragi.
Yeah, okay. Even sesame is actually very
sesame is very good. Ragi is easy to actually. Correct.
Sesame, you just need to sprinkle it over food. Is weight bearing exercises better than calcium tablets?
Both are better.
Go for both. So it's not like one over the other, right?
No.
You need both.
You need
supplements. So many people have this thing that a diet itself is enough for my calcium and vitamin D. How much do you think it is possible?
Okay, 1000 milligram of calcium is like 1 liter of milk. Can you take it? The answer is in this. Okay, no. You need to take your supplements also. You need to take a proper diet also. Both together, you can achieve the required amount of calcium you need in your body.
Which is better, micronized progesterone or synthetic progesterones?
Micronized progesterones.
Can women over 60 start HRT?
No, from my side.
One food you wish every perimenopausal women ate more?
Food for thought.
Very interesting, yeah. So everything is in moderation.
Yeah,
that is the best food for thought, I would feel, right?
Exactly.
Because most of the time after 40, your BMR comes down, basal metabolic rate also comes down. There is a nutritional demand as well. How often should women do a DEXA scan post 45?
Yearly.
HRT and breast cancer, exaggerated fear or a real concern?
Definitely exaggerated fear.
Right. What are the common side effects of HRT?
Common side effects of HRT, estrogen itself can cause hot flashes sometime, you know. Okay, we don't see much this thing, but then, you know, I have seen patients with vaginal bleeding, you know, and we need to check their breast self-examination every month and clinical examination every year, you know. Those things we need to teach the patients.
So, what test do you take before prescribing HRT?
Yeah, there is a panel of testing which we do. I name it?
Yeah.
Okay. Starting from basic CBC, vitamin levels, TSH, FSH, LH, your fasting lipid profile, your sugar levels, your cortisol levels, DHEAS, androstenedione. Yeah.
A liver function test.
Yes, liver function test, renal function test, HbA1c.
Yeah.
A master health checkup.
Yeah. Can women with hysterectomy take HRT?
Yeah, but then we don't need progesterone with that.
Can women who couldn't take the contraceptive pills use HRT safely?
Couldn't take was their choice. They can still do HRT, but the contraindications for contraceptive pills also hold good with HRT. Also understand that HRT is a very low dose of hormones when compared to contraceptive pills. So yeah, again, as I told, HRT can be only estrogen pills, transdermal patches of estrogen pills, which can be still used even for the patients with history of breast cancer.
Are there risks for heart disease with HRT?
There used to be earlier. Documentations are still there, but with the present dosage which we are giving and the present estrogen types which we are using, HRT is only protective for your heart diseases the first 5 to 10 years than causing a heart disease.
Very important concern. Does HRT itself cause weight gain?
HRT itself will not cause weight gain. But because of your menopause and your dietary changes, you will have weight gain. And you will very easily attribute it to, because of HRT, I put on weight.
Everything, no? It is we associate it because of our...
See, the weight gain can even happen because of husbands, you know.
Yeah.
You know,
Very
as simple as that. You can blame it to anyone. But
Correct.
you know, it's your hormones which are playing the role.
Yeah, very true, very true. I had a very, very insightful session discussing this very important aspect of a woman's transition, the perimenopause and menopause, and the role of hormones, and how science has grown to, giving the option of having something like this today. Because if there was no contraception, I think the contraceptive pills was one of the most important technological changes that empowered women. Else, she never even had a choice of birth control previously. Yes. So it was like literally taking charge and empowering a woman. So likewise, again, HRT for menopause and perimenopause is an option which is available, which is can be very, as you said, tailor fit, and can be used in people judiciously and not over the counter. And I think it is better people talk to their gynecologist and then take it. And it was a beautiful session, and thank you so much for coming to our podcast.
Thank you so much for inviting me to this fruitful session. I hope it would be a great help for the public also. One last word. Menopause, we just laugh and leave the matter most of the time. Next time when someone says, oh, she's menopausal, be empathetic towards her. She's going through a lot. Correct. And the maximum or the minimum you can do is help her.
Very true. Very, very true, and profound too. Because when we are changing, I think if people understand this is not just tantrums or attention seeking, or we have become mad. So it's definitely, it is worse than adolescence. That's what I would say, right? At least that time there's these hormones come into play. They are difficult to handle. Now these hormones are taken away from your system, so it's even worse. It's like taking away a gift.
Yes.
So and how do you expect us to behave? So I think it's a very I was so happy to have this conversation with you, and thank you, Dr. Bharathi.
Same here. Thank you so much. See you soon.